for your continued flexibility as we try to maintain proper social distancing while also keeping our residents throughout the county and our region informed. I'd also like to thank Dr. Michael Mendoza, our Commissioner of the Public Health, for being with us today and for all of his work and for everything he does every day on behalf of our residents to keep us healthy and safe. I'd also like to tell you we're joined today by Dr. Tom Mahoney, the Chief Medical Officer from Common Ground Health, and we're also joined by Anne Marie Cook, the President and CEO of Lifespan, who are both working tirelessly through this crisis on behalf of our older residents in our community. Nursing homes serve an important role in Monroe County. They care for and are home to our loved ones, many of whom are amongst our most vulnerable and can be the most severely impacted by COVID-19. They are on the front lines of this crisis. The coronavirus has a disproportionate impact on the seniors and more vulnerable populations who reside in their facilities, and this has forced them to close their doors to the public. We can no longer visit our loved ones. At best, we can hope for a phone call or a visit through a window, and that is incredibly hard. That is incredibly hard on our families. That is incredibly hard on the residents who call these facilities home. And that feeling of concern and a sense of anxiety over how the facilities are operating are completely understandable. I am just as concerned as the residents who are at home and those who call these facilities home. Nursing homes must be in a position to address this pandemic and take steps necessary to protect their staff and their residents. Ensuring their health and safety is a top priority for me and our team here at Monroe County, which is why we have taken a number of steps to help them and help to address the issues that they're facing. Our assistance has been focused in a number of different ways, including equipment, training, organization, and emergency relief. The first step that we've taken is to directly address the needs related to personal protective equipment, otherwise known as PPE. Over the past 6 weeks, Monroe County has provided over 330,000 pieces of PPE to 48 different nursing homes and long-term care facilities in the county. This includes over 290,000 masks, 12,000 pairs of gloves, and over 15,000 gowns. We are also currently making arrangements to provide an additional 225,000 masks for all of our nursing homes, which represents a 1-month supply for all of the nursing homes for both the staff and for the residents who are in a position to be able to wear them. Part of providing those supplies and the PPE is also ensuring that it comes with proper training and proper use. Our Department of Public Health ensures that everyone involved in the operation of the nursing homes, top to bottom, are using PPE most effectively to prevent the spread of the virus. That means that they know how to properly use it, reuse it, and dispose of that critical equipment. The Department of Public Health is also offering guidance on how to properly isolate and quarantine residents when necessary. Beyond those steps, the county has also taken the step to convene a task force, including members of my team and representatives from the nursing home systems, which meet several times a week to facilitate communication, share concerns, and address any common needs that may arise. It is this task force that has spearheaded the efforts around PPE in managing supply levels to ensure that no one runs out. It is also this task force that is working to address the staffing needs at local nursing homes as well. We have connected with them with alternative staffing options, and we also stand by and ready to tap into our resources, such as the Medical Reserve Corps or a county contract with a temporary staffing agency should any facility reach a crisis level and need immediate temporary relief. I also want to note that as a county, we operate a nursing home too. Monroe Community Hospital is entrusted with the care of hundreds of residents, and our staff there knows firsthand the struggles of all of our nursing homes are facing. They are working tirelessly in this challenging situation, and I believe that our staff is doing everything they can to protect and keep their residents safe. This means properly using and maintaining appropriate levels of PPE. It means staffing levels and taking the actions necessary to maintain those safe staffing levels. And it also means effectively communicating with families and residents so they know that their loved ones are well cared for, even if they're unable to see them. Our staff at MCH has been working very hard with the families to in our facility to keep them informed of the status of COVID-19 amongst residents within the facility. And I'm very glad to hear that the governor is planning to sign an executive order that would require the reporting of positive cases and COVID-related deaths to families within 24 hours. It is critically important in order to build trust between the facilities and the families that call them home, that information is shared. I'm also happy to have just heard that over the last in just the last half hour to hour or so, that the governor has announced that they are working on data related to each individual home, and will be able to follow up on that as appropriate. I think that's necessary. I think that's a great step, and I'm glad New York State has decided to do that. It is really important that we take what's going on in our nursing homes seriously, and we do whatever we can to support their operations. These are the homes of our seniors, some of the most vulnerable residents, and they are the most impacted by the spread of COVID-19 in our community and across the county and across the country. What we have done here in Monroe County is to build a collaboration and a coordination surrounding nursing home and long-term care facilities in a unique way to make sure that we're driving a community approach to protecting residents, but that we're also providing what facilities would need in terms of training, guidance, and equipment. And I'd also like to take an opportunity to thank those who are working within those facilities for the work that they are doing in trying to make those connections between families and residents. Those connections are incredibly important. And this is an incredibly stressful situation for families to be in, because they know their loved ones are at the most risk in our community. They know that these are the most vulnerable people who could have a bad outcome from contracting this disease. And it's also a situation where it's very difficult to be able to allow visitation, because you have to be able to stop the spread and introduction of this disease into those facilities. So we take this very seriously, and I'm glad to be joined by several people today who can speak about nursing homes and steps that are being taken outside of what I've just addressed to impact that, what challenges nursing homes are facing. So I'd like to turn this over now to Dr. Michael Mendoza, who is our Director of Public Health for Monroe County.
Thank you, County Executive Bello. And I also want to add my words of thanks to Dr. Tom Mahoney, Chief Medical Officer at Common Ground Health, as well as Anne Marie Cook, CEO and President of Lifespan. Two individuals who have been great partners in this community, not only around the health and well-being of older adults, but really around the health and well-being of all people in Monroe County. I also want to add my words of thanks to my physician and medical colleagues who do the hard work of providing care for our older adults, and most especially those who work in nursing home settings, because we know that you are working tirelessly, even in the best of circumstances, to provide the best quality care for our loved ones. And we know that during this very unprecedented epidemic, you are working double time to make sure that we are doing everything we can to keep our older adults safe. We've received many questions about the number of COVID-19 cases in our nursing homes, both among residents and among the staff who work there. And I want to assure you that we share all of the same concerns that our family members, our loved ones, our friends, and the general public have for those who are living in nursing homes. We know that these are some of our most vulnerable residents, and we absolutely want to do everything we can to provide them the best quality of care. I want to assure you that we are doing everything we can to work hand in hand with the nursing homes themselves, with the New York State Department of Health, and with our healthcare systems to educate staff and family members about the spread of this highly contagious virus. The reality is that the responsibility we place in our nursing homes has always been great. And that is especially true now as they face this incredible challenge of fighting against the COVID-19 epidemic. We know that people in nursing homes are naturally more susceptible to contracting COVID-19. Typically, they are older adults, often with medical conditions, being cared for by staff who often work in multiple facilities due to the shortage of qualified staff in our community willing to undertake this very difficult work. Nonetheless, our older adults have borne the greatest burden of COVID-19 illness, with almost 30% of our confirmed cases and over 85% of our deaths to date having occurred among adults 70 and older. The governor announced yesterday that the New York State Department of Health will be doing a deeper dive into the data. And as you just heard from County Executive Bello, They will now be taking proactive steps to ensure transparency around the data, both with regard to the nursing home identity as well as general identity of individuals who are afflicted by COVID-19. We believe that this is a step in the right direction. I believe that this is going to greatly assist our ability to support the state regional office and ultimately to help the residents and families who are working more directly with these nursing homes. As I've stated in the past, our primary role within nursing homes is to support the State Department of Health and their efforts to conduct contact tracing and the mitigation strategies within these nursing homes. When we become aware of residents in nursing homes who have a positive COVID test, we work very closely with the state to ensure that they and the nursing homes have the information necessary to implement containment and mitigation strategies. And on that note, I will add that the data on tests for nursing home residents come to us from a variety of sources. Much like hospitals, who are also regulated by the State Department of Health, we will learn about tests ordered at nursing homes usually only after the results are reported in the state lab system, and we download these results every morning. Likewise, when deaths occur, typically we only hear about those days later once our Office of Vital Records has the responsibility of completing the death certificate and issuing the death certificate to that loved one's family. So I want to reiterate that I know that these are difficult times, and I know that our nursing homes are working their absolute best to meet the challenge that the COVID-19 pandemic has given to all of us. We in Monroe County, as well as in the Department of Public Health, stand ready to assist the state, our nursing homes, and the people they serve to provide them with the guidance and assistance as best as we possibly can. As you heard from County Executive Bello, we have convened and we are now actively participating in a task force locally to address some of these needs. And with that, I want to hand it over to Dr. Tom Mahoney, who is one of the individuals who we've asked to lead this task force, to say a few more words about the task force and the work that it has undertaken.
Thank you, Mike. I'd like to introduce myself to the group first. I am Dr. Tom Mahoney. I'm a primary care physician for the past 40 years. I now am at Common Ground Health, which is a community not-for-profit that has been functioning for 40 years to help with planning for the health needs of our community. I was honored to be asked to help create a collaborative among the hospitals and nursing care facilities in our community to try and improve the outcome for all our citizens. That group has been meeting 3 times a week for the past several weeks, looking at issues that are important to try and decrease the impact of COVID on our aging population. As Dr. Mendoza mentioned, this is a group that is at increased risk. If we look at the numbers from across the country, a huge portion of the deaths that have occurred because of COVID has been in the elderly. The reasons are both aging itself and the impact and the chronic diseases that are there. And we also want to recognize some of that is due to the social conditions that some of our population live in. As an agency, we have followed the disparities that occur in health outcomes. Those disparities are mirrored in what is happening with COVID and is a focus of our agency, the county, and all the treating nursing homes that are engaged in this process. I have to say that as one of our resources, we look at the national organization that is the directors of nursing homes. We've been in regular contact with the New York City nursing homes, and we're looking at what is occurring across the country, what is working, what isn't working, and what direction we can go. I'm proud to say that as we look at the national group, our area is perhaps the only area that has gathered all the providers together in a collaborative to try and improve outcomes. And I believe we're going to see positive results because of that work. I would like to also next pass it on, if I can, to Anne Marie Cook, who is the CEO of Lifespan, and also engaged from the community point of view in the same collaboration.
Thank you very much. First, I want to thank County Executive Bello, Dr. Mike Mendoza, and Dr. Tom Mahoney for your incredible and outstanding leadership during this crisis. I also want to talk about and applaud Governor Cuomo's executive order that he will be signing requiring nursing homes, adult homes, and assisted living to tell families if anyone has tested positive for the virus in those homes. I believe the homes in our area are doing a much better job than in some areas of the country. Staff within these facilities, of course, are heroes, and they are among the many frontline essential workers who are striving each day to do their best under extremely difficult circumstances. But I stress the families and those residents need and deserve frequent and honest communication about COVID-19 and what the home is doing to combat the spread. We at Lifespan are getting calls. As you can imagine, families are worried, families are scared, and families are very anxious because they can't see their loved ones. And we all know that this disease can be devastating to older, frail, and vulnerable people. So of course, families are worried. So information that's being required now is needed to relieve their fears, to help them understand what's going on, and families need and deserve this information. So I thank the local team who are really working to help long-term care get the PPE they need, as well as to help everybody receive the information they need so that families, residents, and the community can be assured that we're doing everything we can for older adults in long-term care. Thank you.
Okay. Thank you, Dr. Mendoza, Dr. Mahoney, and Anne Marie Cook from Lifespan, CEO of Lifespan, for those comments. And then we can ask any members of the media have questions. We can go through the process. So Julie Phillip will take us through that, but I appreciate the input. And I also would like to say that I appreciate the partnership. This is in many ways, like Dr. Mahoney said, is unique here. I think to Monroe County and this, it's obviously unique in Monroe County, but around the state, this collaboration that we've put together to make sure that there is the communication, the cross training, and from our end, I'm really looking at making sure that we stand ready in an emergency situation, should that be called for, and we need help while we wait for a state intervention, and then also that equipment is put on hand to make sure that nursing homes have what they need. So I'll turn over to Julie Phillip, who can help manage questions from the media, and she'll give you a call on you.
Our first question comes from Tanner Jubenville from 13 WHAM. Steve Orr from Democrat and Chronicle is next.
Hi, good afternoon. First question, I wanted to talk about staffing. Are there any facilities in the county that have had issues with staff getting sick from COVID-19? And I guess, have there been any facilities that have had trouble keeping up numbers, staffing numbers?
I would say, does Dr. Mahoney or Dr. Mendoza want to answer that? Sure. Dr. Mahoney?
The answer is that COVID has taken a significant impact on a number of the nursing homes, and in fact also in some of the hospitals, related to the care that they've been providing. The nursing homes and hospitals are taking every precaution they can to try and keep their staff healthy. However, this pandemic is a new experience, and I think back 3 weeks and really knowing how to best protect staff has changed significantly as national and local data becomes more available. So the intensity of protection has increased significantly. At this point, staffs are working very hard. The nursing homes are being particularly supportive of their staff to try and ensure that they can continue to work in a safe environment and continue to provide the care that they are. Our view of this has been that they've done a phenomenal job in always keeping their staff up to a level to provide the best care they can for their patients. We haven't run into any serious issues at this time with staff being insufficient to care for the patients in that home. It has required some shifting of staff. In some cases, it has required nursing home residents to have moved in order to be in facilities where the care can be provided.
And a follow-up, Tanner?
That kind of goes into my next question. So I know there's been maybe some emergency plans in place to isolate patients or not patients, but residents rather, who become sick. And typically are these plans keeping the residents on the premises, or have there been any plans to move residents who may have become sick anywhere?
What has happened is the standard of care has been to take patients who become COVID positive and ill and try and get them away from patients who are healthy and not having problems. When that can be done within a nursing home, that has been occurring. So we've moved patients who are sick to a separate wing. The intensity of PPE is increased dramatically in the process to try and both protect staff and the other patients in the home. Unfortunately, this disease still is transmitted even with best precautions. The intensity of the precautions has increased from when the outbreak first started to occur. There have been situations where both here and across the area where, in order to keep patients in the safest environment, patients have had to move. And in those situations, it's to try and isolate those who are not ill from those who are. Within the nursing homes, they also have taken the approach that as a patient comes back to the nursing home after having been hospitalized or is coming from the hospital without a certainty of their diagnosis, that they're put in an area where they are not with either patients who are definitely sick or patients who have been in the home and have not been ill. The ability to do this varies with size of nursing homes, with staffing available, but what we're seeing is the intent and the process to try and protect as many of the residents as can be protected is occurring in virtually every situation.
Okay, our next question comes from Steve Orr at the Democrat and Chronicle, and Wendy Wright from Spectrum News will be next. Steve Orr.
Sorry.
Steve Orr.
Now you can hear me, I take it. I'm at a disadvantage only because I missed the beginning, Adam, and I didn't hear a word you said. So let me just ask a preliminary question.
Sure.
Are you in a position where you or anybody there, where you are identifying which homes the deaths or the positive cases have occurred in? I mean, this is, yeah. Well, let me just ask that.
It's Dr. Mendoza.
Yeah, I think I heard your question. I think my connection was breaking up there, but unfortunately, no. We've asked, our role is primarily to support the state. And so we've made the state aware of the nursing homes where we believe there may be something to look into, but we've really left it up to them to do that investigation. The reality is that our data locally are not perfect, and I couldn't even tell you if they were an under or an overestimate, because I think the data that we get are coming, like I said, from various sources. So, you know, we want the state to do a full investigation into that. And I think what you've seen today from the governor is evidence that they're taking this very seriously. So, you know, we're looking forward to seeing what they discover. And at that point, we'll be able to assist the state however we can.
Thank you. If I could ask a follow-up to anybody who feels able to answer. Some nursing homes that I've spoken with have had no cases. Other nursing homes I'm familiar with have had a very large number of cases. Can anybody address why that would be? Why would some homes be so successful and some homes be so unsuccessful at keeping the coronavirus from infecting their residents?
I can
Dr. Mahoney?
I can take a shot at that one. The answer is that this is a disease, the pandemic itself is something that we as a country and have not experienced in over 100 years. It's about a disease that's highly infectious, that is carried without knowledge of those who are in the pre-illness phase of this. The visitors who had come to the nursing home before the restriction was put on visiting may have brought the disease in. We recognize that staff are a potential source for bringing the disease in, and hence what we've seen is a lot of changes in how we've handled this over the several weeks that this has been going on. Once you're in an environment where the virus has been present, despite best cleaning, despite trying to isolate, spread still occurs. It doesn't reflect that nursing homes are doing the wrong thing. What we see is a high standard across the community. And just as looking at neighbors who have gotten the disease and others who haven't, often, and in fact most cases, you can't identify the source of the virus and attribute it to a single source. The increasing intensity of restrictions and isolation still is not perfect in preventing spread of this, as would be affected simply because of the nature of the illness. I think we're all aware from the national news broadcasts and what we hear, this is not something that we can cure and eliminate completely until we're having either effective drugs or effective vaccine. And it is the outcomes at nursing homes or the presence of someone who's ill does not indicate that a nursing home has particularly failed. They may have gotten a transfer. In fact, I believe there are cases where we've documented the disease got into the nursing home after a patient came out of the hospital and was sent to a nursing home without symptoms, and therefore never could have prevented that. And the difficulty in testing, particularly at the onset of this, made that even more problematic.
And I'll just throw out there, thank you, Dr. Mahoney and Mr. Orr. We can make the tape of the whole press conference available to you after the fact, so you can see what I laid out at the beginning. But what I had laid out in my opening comments was related to the county's response to working with nursing homes in terms of pulling together the task force, protective equipment, training, and emergency stand-up if necessary. So we can get you details on that in the full recording.
Okay.
You're welcome.
Next up is Wendy Wright from Spectrum, and Brett Dahlberg from WXXI should be standing by.
Hi there, thank you. I just wanted to clarify the numbers a little bit more. So are you saying you don't have the complete data because this is under the state, under the state's purview, or can you tell us at this time how many patients inside nursing homes in our area are COVID positive, and at which nursing homes they are located?
Right. I can tell you that I don't believe I have accurate data. And so to that end, I don't think I can release that because as you all know about me, I stand very firmly behind accuracy, and I don't think our data are accurately portable.
Can you say with the 30% you mentioned before, the 30% of the positive cases were the older population, I think if it was over 70,
Yes.
how much of that are people who are in a nursing home?
As I just said, I'm not confident in the data that I have regarding the patients in nursing homes. So I think the more broader statement is accurate, that because we have ages very accurately. But as far as attributing them to a nursing home or not, like I said, I don't think I can make that statement with very much accuracy.
And can you clarify a little bit what the state is requiring in regards to when a patient is ready to leave a hospital, a positive COVID patient, and are nursing homes required to accept them? And if so, is that the best idea right now, considering the population inside the nursing homes?
Well, that is the expectation. And the challenge before us is how to mitigate any risks associated with that. But it is true. The expectation is that they would be able to return to the nursing home where they came from. But I will point out that a number of the people who are discharged from a hospital are not nursing home residents, but will need to go to a nursing home for acute rehabilitation following a hospitalization. So that is sometimes where the complications occur, because that is, as you can imagine, a stress on the system. And so I think our nursing homes are working very diligently to manage the risk associated with that event.
Thank you,
Thank
Wendy.
you.
Brett Dahlberg from WXXI is next, followed by Berkeley Breen from News 10 NBC.
Hi, all. Thanks. The University of Rochester Medical Center's pathology lab told me yesterday that they're beginning to test samples from nursing home residents who are not symptomatic, who don't have symptoms of COVID-19, but they also don't have the capacity to handle tests from every non-symptomatic nursing home resident. And so who is deciding, and on what basis are they making the decision about which nursing home residents who are not symptomatic are getting tested?
So as you know, the CDC and the State Department of Health have not changed their guidance since last month regarding the testing of individuals, and currently testing asymptomatic individuals is not part of the guidelines. But as you know, we've learned a lot since then, and so the decision to test asymptomatic people at this point resides at the level of the health system and the individual treating physician. So that is a decision that I think is reasonable given what we know now, and it is a decision that is being undertaken at the level of the health systems.
The state guidance says that those decisions should be made in consultation with the local health department. So when the health department is consulting on these things, on testing non-symptomatic patients, what criteria are you looking at to determine whether a particular person with no symptoms should be tested?
So I want to clarify, the consultation really is at a population level. And so, our job is to share the guidelines, and that's what we have. And, the hospital systems know the guidelines. But when it comes to testing individuals, I've been very clear that individual clinical judgment is what supersedes, population level guidance. And so that level of understanding is what the health systems will consider in making their decisions as to whom or to test or not.
All right, thank you.
I think you're on mute, Julie.
Yeah, Julie, you're on mute.
Next up is Berkeley. I have to stay
Okay.
on mute. Next up is Berkeley Breen from News 10 NBC, followed by Patty Singer with Minority Reporter.
Okay, thank you very much. The last report is 57 people have died in Monroe County from COVID. How many of those 57 deaths happened inside nursing homes?
As I mentioned earlier, Berkeley, I don't have confidence in the data about the nursing home deceased, so that's not a question that I can give an accurate answer to.
So when somebody is reporting a death to the county health department, they don't say it came from this particular hospital or this particular nursing home?
They don't report those deaths to the health department. The nursing home deaths will occur, basically unbeknownst to us, and we'll learn about them generally after the fact through vital records. And so if we happen to know a death has an address associated with a nursing home, that might be helpful. But like I said, we don't have complete data on that. So that's not something that we can, give a good answer to.
What information do you have from vital records right now in terms of deaths inside nursing homes?
We have the names and the, identifying characteristics, but typically we won't necessarily know that they are nursing home residents unless we happen to know that they were ordered, the tests were ordered with an address that's affiliated with a nursing home. But sometimes the address is not accurate on the lab slip. And so we have no way of attributing those data to nursing homes 100% of the time.
Okay, just one last question here, please.
Please, out of respect for the other reporters, please let us move on. Adam, did you have? Okay.
No.
Next up is Patty Singer, followed by Will Astor from the Beacon.
Hi, thank you. A lot of times the staff in the nursing homes, the CNAs and things like that, they may be at risk just because of their socioeconomic, racial, ethnic status. How is this presenting a double risk to those individuals, those care providers, as well as to the people they're providing care for in the nursing homes?
Dr. Mahoney?
Sure. The answer is that the nursing homes have shown tremendous focus on making sure that all their staff have adequate equipment, training, and protection to try and keep them healthy. In terms of difference related to higher risk because of their socioeconomic status, there is a universal highest standard that's applied across the board right now. The interest of the nursing home is to keep their staff as healthy as they can to provide the best care they can. And from the shared experience that we've seen with the committees, the level of protection for them is the highest order in their planning and execution of care. I really feel quite comfortable that that there is no lack of attention to protection across the board in the nursing homes as we go through the processes that they're using in terms of protection and the help that they've gotten from the county to make sure that no one has run out of equipment.
But the mayor has said that the message in minority communities hasn't gotten out to social distancing and things like that. So these individuals are out in their community and then coming into a nursing home, potentially having been exposed outside, bringing that in. Is there any way of minimizing that? Has been any talk, any ability of perhaps staff that's asymptomatic housing that staff in the nursing home to try to keep them, if you know somebody's not positive, try to keep them that way as long as possible?
Patty, I really think that the training that's being provided within the homes has tried to stress safety, certainly in their job, but in their life in general. They are, if they're not following the recommendations for the community, they're at risk. I can't say I've specifically spoken to them about whether they're encouraging their staff to protect themselves at home, but I'm aware of the training that's being given that focuses on that in all activities.
Thank you.
Next up is Astor from Beacon, and Kayla Green from WROC TV is after him.
Yeah, hi. I'd like to get some clarification on the testing question. It would seem that ideally, if I know the nursing homes are locked down, they're isolating COVID patients. But it would seem that ideally, if you were really going to control it, you would test staff on a regular basis that are coming in and out, and you would test individuals regardless of the clinical judgment of the hospital or system that are moving from hospitals to nursing homes. Is my assumption wrong? And if it's not, what is preventing us from doing that kind of testing?
So I don't think your assumptions are wrong, but I would add a couple of points. One is that the decision to test, I think, is still at the level of the medical director overseeing that nursing facility. We know that a large number of them will still not choose to test somebody who is a roommate, for example, of a known positive, and simply presume that that person is positive because the outcome and the precautions and so forth that would result from that would be essentially identical. That being said, that there are some nursing home medical directors who will elect to test in that circumstance, and I, defer to their clinical judgment on that. With regard to testing the staff, we know that that is occurring because we get those results. And generally speaking, they will only test staff who are symptomatic because that has been the guidance until now, until recently. And very recently, we've started to see more people testing asymptomatic people. But again, the interpretation of those results is challenging because if somebody who is a nursing home staff and gets a negative result, again, I've always said we don't want to, convey a false sense of security under those circumstances because that negative test may in fact be a false negative. And so, the guidance and the interpretation of these results is complicated and ultimately at the discretion of the clinical director and ultimately the state.
And I'll share that on the national experience, when we've been talking with the national organization, places that have tried this have not found that it has changed transmission that much. The tests can be falsely reassuring and may actually increase risk if people take less precautions in those situations. So I think we're seeing that our knowledge about the illness needs to progress to know exactly what's going to be the best approach.
You have a follow-up?
So can I assume from your answers that the problem is not availability of testing?
Correct. I don't think that's a limiting factor at this point at all.
Thank you, Will. Next is Kayla Green from WRSU TV. Kayla?
Hi, everyone. So my question is just about protocols that are going on in nursing homes right now. Like, are residents seeing the same nurse every day to limit exposure? Or what would happen if a nurse did test positive? What would happen with the patients she was seeing, she or he? Just kind of about protocol going on there now.
What I can say is that every effort is made to have consistency among caretakers. That's limited sometimes by the ability to have the same people on staff in location because of absence, because of illness in the family issues. Often the knowledge of someone not being able to come in on a day comes in at the last minute, and staff has to be shifted to ensure that there's adequate staffing for everyone. What I do want to recognize is that much of the staff that we're talking about is incredibly dedicated. And the nursing home directors who I speak to come back with stories of how folks are going out of their way to try and assure the consistency that you're talking about. And I think it's very important in hard situations like this, where inevitably staff are seeing poor outcomes that were beyond their control. The way they've stuck together is really remarkable. And I think as a community, we need to recognize them as true heroes.
And a follow-up, Kayla?
Yeah, and then I had a question for Lifespan, just about how residents are coping with the isolation and any advice that you might have for families who can't see their loved ones right now.
Yeah, I was just going to add, I mean, the best thing that can happen, quite frankly, is consistent staffing. And I believe that best practice is still in practice, because for older adults, it is very difficult not to see your families. And for families, it's heartbreaking. That's really the calls we're getting. Our families so concerned about their loved ones, and they need to know there's consistent staffing so that people see the same people every day who are caring for them. And it's particularly difficult for those individuals who have dementia, who don't understand what's going on or why they can't see their family members, why their routine is changing. So it's my understanding from the homes, as well as some families, they're doing everything they can to have consistent staffing, to have consistent routines so that people can receive the care they need and also reduce anxiety.
Thank you. And so I think that got to everyone. I want to thank all of you again for participating today in this in the press conference. I also want to thank Dr. Mahoney, Dr. Mendoza, and Anne Marie from Lifespan for the work that they're doing. This is just another, and really my whole team here in helping to coordinate the response to this. Obviously, the COVID-19 pandemic has impacted many aspects of our lives, and the health and well-being of our residents here throughout Monroe County is obviously our #1 priority. And pulling together this group and the task force that's being led by Dr. Mahoney and his colleagues at the nursing homes has been a great step in this. And it's like this with a lot of things that we've done in our response here in Monroe County that's maybe even a little different than other communities, by pulling together coalitions from like organizations within each industry so that there can be collaboration, cross-training, sharing of resources, and identifying common problems that then the county can step in and help address, whether that's through training, additional resources, advocacy, equipment needs, things of that nature. And so we're going to continue to work on this, and because this is important. And as Anne Marie Cook has demonstrated, and Dr. Mahoney, we know this is a stressful situation for a lot of people in a lot of different ways, particularly because for the safety of residents and safety of families, it's very difficult to be able to implement visitor policies, and there's visitors restrictions to this, just like there are in the hospital systems, and that can be very difficult and add to the stress and anxiety. And my heart goes out to all those families who are separated from their loved ones right now. I want to offer my condolences to families who have lost loved ones related to COVID-19, and let you all know that you're all in our thoughts and prayers every day. Hopefully that the efforts that we're taking as a community related to nursing homes, long-term care facilities, but in addition to our social distancing techniques and all the efforts that this community is really pulling together to do, will have an impact that allows us to come through this together as a strong community. And so we're working very hard, and we're doing this to help protect as many residents in this community as we can. So we'll continue to have this conversation and provide updates, and we're going to work very hard on this. This is a priority for us and for the greater community. So thank you all very much.
Thank you all.
Thank you.
Thank you.